Nana Fatima Amodu akwansahwe wo ekumfi Essuehyia ayaresabea abra otse ekumfi TV that together ekọ ayaresabea wo ma na se nsuto a na se ampe bebi ankata wo za na kire nsu bobro da jama igine nsu no mu da monti Nana Fatima Amodu a oye ekumfi srafa de hye na so ye mputuhin se me ekumfi srafa no oye na yemhyishi da monti no to na mon na okasre ayaresabea na ekumfi TV so ya boy pin na yene call apro abra okishia oye asupiti no nipa na oda no na yin twunkomo na nkomodizemu ne hu de asupiti ne nyambo bebre abra oye hon ne da na mpo no ntuto nwi no de mas no hon electricals awo ho nyina ra kira nyima ahoze na wo no otosi no onam de nsu no ta obugu oye light no don ekiro so no hwe maternity ward ebusafo sa ehwe ma okodo ho mo za de kire oyare ho ya kire Essuehyia ayaresabea no ohia mboara nkasa.
Facebook, and then I saw TV showing a report on some damages the hospital has suffered, and I was actually born in this hospital.
Wow.
Hospital, yes.
We have to pay back.
So when I saw it, I mean, I've heard the news, but when I saw it, it was quite sad.
Yeah.
And coming from a country, and the fact that I was born here.
Yeah. You were touched.
Yes, so I called my team. We decided to come and look at the problem firsthand, and then find out what the issues are, and then how best we can also support.
Okay.
Yes, so that is why we are here.
Yes, thank you very much.
You're welcome.
It's true. As we said, Essuehyia Center for Ra, that's the biggest health facility in the district. It was renovated, I think, about 2-3 years ago, but it has gone bad. It's really like one village, one dam. You can't stand there. So we were looking at appeals for people if they can come and support us to do the renovation. We have had discussion with the assembly. And they said they have given they give the listen to contractor. He had done his part, has gone. That waiting period or so is also part. They can't go into to come back and do the renovation again. It means there to be a new contract. And you know the challenges with us. So that has been the headache now. So I've been discussed with Omani, who was also trying to link up to other people to have. Among ourselves, we're also trying to get into what people who would think can support us. So, getting this news from you that you want to come assess the place and see what you can do, I don't think I will say anything than to. We're so grateful. I hope that after we go and assess the place, whatever efforts you can do, whatever links you have, we will support you. Whatever you also think you will need on our part, we're willing to do that. So together, we can put the facility in shape. Government cannot do everything for us because there are competing demands, education, health, agri, what have you. So it's on ourselves, individuals, at least we give back to society. Having been born here, it's nice you can give back to society or the hospital. So I think it's a good thing, and my team is happy to get this good news. So I think we want to go and look at the place.
Sure.
And I wish that it was raining. But it's okay when you go look at and you see how it is that the state of it. Like some days are where they are not so simple on their own. They are also trying to do what they can do to help us renovate it. But if hands can come from anywhere to help, the assembly to government, the government to assembly will be happy. Yeah. So it's a good news. So we'll go and look at the place. Then together we see.
You mentioned they've done a contract and then they need to come and award.
No, it was awarded for renovation.
Okay.
I think before I even came, some years back.
2016.
2016. That is now, it has gone bad. So in my follow-up to them, they said the contractor has haven't finished his work. And that waiting period for defects to be rectified has elapsed. So you can't come back here again. That means awarding or getting a different contractor.
Okay.
And that has been a challenge now. Understand?
But are they willing to pay if it's just about awarding the contract?
What awarding willing to pay at the assembly?
Yes. But what you are saying, they are looking for a different contractor.
Yes, but I think the may also be challenged. The may will be challenged. Other than that, it should have been done because it's a serious problem for us. It's not a challenge because it has not affected electrical wiring there.
Okay.
So you go to most of the units, the wiring is affected. So when it rains, the fans cannot work, the other sockets are not working. Yeah. So it poses danger to staff, property, and even the clients. You know, water and electrical systems can explode. So this is the problem that we are facing with the facility. But not only in the Essuehyia, for liberties always ask for you are a chief for the area, isn't it? So don't extend only your Essuehyia where you are born, but you can extend to the whole of the district, because that's what we are for. We're not only for one facility. So even if the help comes and we think that it can be spread to other places, we'll do that in conjunction with your agreement. So use your links to think of the whole district, but more attention on your place of birth.
Okay.
Rather, aside the leakage on the facility, are there any other challenges that you are facing?
Yes, equipment.
This particular place.
Yes, equipment. Now we have a policy of model health center. Model health center where they were designing some health facilities as model health centers. That was there by referral or hubs for the smaller facilities. And luckily enough, the complete district here we have Essuehyia from at the model health centers, which means that these 2 health centers, in addition to Nakwa Clinic, they should have the right mix of people, staff, and equipment to enable them work and provide quality care services to the people. So, because of that, we need equipment that can enable these facilities do the services or the healthcare that is required of a modern health center. So, equipment is one. Then accommodation. Accommodation is so key. So even if you can even get private people to come, but staff are willing to rent, but they cannot get. Others have to even stay in a magazine, one number. I do not solve and coming, which is not it's very, very far. But we can able to build some thorough building for the staff is fine. For government to use for the staff is fine.
So if they build, it will be at a cost.
Yeah, it will be at a cost.
And then workers are willing
to pay. So we can use all things to get private estate developers to come. I think we can also release part of our land. I will go into some agreement and we see how that can be done.
I'm grateful you brought this up. Earlier this year actually, I think I was in a meeting and something like that came up. But unfortunately, people have their own interest in that thing, so it was kind of shelved to the ground. But I'm happy you brought it up. It's something I'm also willing to take.
So you look at it. It's not only here. Nakwa Polyclinic too. That is for now. That is our hospital. That's a hospital. You go there, it has no space. No space. The office, the whole place is congested. If you know the place, it's too small to accommodate staff. You go to one room smaller than this. You have 3 offices, different offices. Combining that, understand, is a challenge. Accommodation too is a problem. They build the facility with accommodation for only 2 staff. The medical officer or whoever will be in charge of the facility and a midwife. That's all. The rest, it means go and find accommodation anywhere or somewhere you can. And that is the problem. Now we have people who are there, they cannot even get. They are looking for accommodation to rent, but they cannot get. All over the world is the same thing. You go to Jankwa, Baptist compound there, recently we send a midwife to the place. No accommodation. And midwife has to be resident. So because she has to be resident, she has to not go there, and those who will stay, they have to move to town, look for accommodation, which is not best. It is the same story. You go to a council for we have staff there who are staying in Essuehyia and go, they cannot get accommodation. So accommodation is one of the challenges that we're having. Equipment. Then transport. Once you are here for all my challenges, so you can try. Once media can help. My friend doctors can help to run our challenges. You go to the transport, Nakwa Polyclinic, they have no car. No car. And that's a hospital. They have at least a pickup that can enable them to outreach services to the communities. You come to the health directory here, what's supervising all the facilities in the district. We have only two pickups. Now they're supposed to go to Otron for some investigation on music cases. Now they were supposed to go to Melco for another exercise. The car will go there and there was a problem, stuck there. And because of your coming, I couldn't release the car to go to Otron. I have to go for because I have to go with you. So these are the challenges you will have in terms of transportation. So any help in this regard, these go a few things I've talked about. Renovation the facilities, accommodation, transport, equipment, or it will be very, very appreciated. Then we're also thinking of two meetings this year. Now we discussed with I think Omahini and the DC and other stakeholders. Now Ekumfi is a rural district. We have staff here who come and they want to leave the place after years, less than 2 years, or even before they come here, they come and see the place, they go, they'll never return. As we speak, we lost about how many staff reported and ran away?
This year,
4 people came and left because based on something that they didn't tell us. But we perceive that to be because of the location of the place. So as part of our measures to also retain staff, we're trying to come doing some staff, Best Advocate Award as a motivation. So we look at people whose input or output have impacted a lot in the healthcare services for award them like best midwife, whatever. So we're discussing. So when we want to extend out that invitation to people, at least the categories, we want to award this. So which of the teams categories you want to sponsor? You want to sponsor the best midwife, he may want to sponsor the best medical officer, Douglas will want to sponsor the best disease control officer. Then you will not give awards. You look at the date, when we are doing it, that you come and be part, then we'll see how we can do, just to motivate our staff. If you do this one regularly, I think people will want to come. When they come, I think they will stay back and help the people. Yes. our challenges. So she came to our office and she mentioned this facility that is dear to her heart because she was born here. And I told her about the challenges, about the deterioration of the place. So she just wanted to come assess it and see what she can also do.
Okay.
So I wanted to come to just go around. We have the media from Complete TV. It's not on air yet.
Yes,
When they're on air, they always give us free time. Free air time. So we'll move from here to Accra and go and watch.
Exactly.
Any program we're doing, we'll come cover it. So we'll just go and take us through the places.
Always online.
Yeah.
Pushing the agenda.
So where are we starting from?
You can start from there.
Where the
This one, started from this one. That's where it started from. But it's now extending to the other part of the whole facility. In fact, the whole facility. So currently, our maternity unit inside the maternity is also leaking, and now you can see that it's also extended to this side. So it's like the whole facility, it needs a total re-roofing. So I don't know, like.
Was it not renovated just 3-4 years ago?
It has been done before, but the problem is still there. I think I don't know what they did. I came to meet, I was told that they've already done that before. And when I came, personally, I and my daughter, we also try our hands to also put something on it, but the more we try, the worse it becomes. So it needs, a total renovation because I don't know. Yes.
They're all coming down because they're working electric.
So I don't know, this one, you will not have a clear picture of the whole thing, but
We already have the one that is winning.
so the rest is downpouring because that is just forced by heavy pouring like a dam.
So it was said like on the so the red
The one is the work was completed in 2016. And where my I started with the 24 years. 4 years.
In fact, we were promised before the election by the former MP that they were going to partition the trees for us, aligning. And up to now, the more we go for feedback, like the really advocates of the line for privacy sake. So that was to have it done yet.
So over here, the problem here is the roofing and the partition.
And most importantly, the wiring. The more we buy box, within few days, not action. So it's like it needs total rewiring, total re-roofing.
The wire, is it just here or the
No, the entire facility. And I quite remember I called one electrician. He was saying, I mean, the time they built the building, I think the wires they used, was it the cable they used, was it the appropriate one that can take the current coming in. It's sometimes, there's power fluctuations and
This is an old facility, so at the time they built it, yes. Okay. But now the demand is high. But using gadgets, they don't gadget will be so that pressure on them is huge now.
So, how often do you have kids, women coming in to deliver?
They come in a month. We can get like 20 to 30 in a month.
The space okay for them?
No, we need more space, more beds. Our beds are run out. Our fan is only one. We have wanted to get in more fan, but due to the electrical problem, so sometimes you don't want to wait fans for that. So when that is done, other things can come in.
This is a maternity leave.
Maternity leave, like
do they bring the babies here?
You were once here.
I was a baby probably. Yes. So I must have slept here somewhere.
They bring the babies, the mothers lie beside them.
So the mothers and the babies share the same. That's what I want to do.
Yes. So we need really causes. We need so many things. In fact, we need a total renovation of the entire facility. It's a big project. We can help us.
We'll do what we can.
Okay.
Okay. Here we go. Oh, right here.
This started the ANC and started the higher level. So this is especially when we are having our ANC started, they come here and the chairs is only three and the space is small. So sometimes we are not seeing people standing. So we have wanted to extend the laboratory. Even the inside, when you check all the facilities in the country, we have more resources, very comfortable. But the room is very small. You only have one person running the lab, and the waiting area is small. And when it rains, you see the breakages will be holes and the amount to go about whole waiting area. Those that they say they are waiting now, they are being beaten by rain. So we really have get people coming and also create a shared plan for them at the waiting area so that we can extend the lab to occupy all this space. So that is our vision. What we are hoping to get. What's the car? There are cracks.
So what are some of the tests you run?
Basically, we do all the maternity lab, like malaria, with that's typhoid, hepatitis. Basically, all the labs except the chemistry.
We never function.
And the room is small, so if you bring the machine, you can find a place to place it.
It's no way, I'm going to stay in my not easy to do because that is easy. Imagine someone who is coming so like public clients here. It's a category. So if you use sample, so I don't know. When I came, I was told that it's so in my own small way, I tried to build around class single room so that they can go there to use it. So and to tidy up the place is a problem because as a senior said, so
the community is not
and the community is also
that's the problem. The community is it. So when you are not around, when you come?
What can I say? I want to say community work. Omega just on who has now, but a whole lot of even this are the type to get your Hey, this one was the video that ran down.
That initially called for the plants. And when you got the plants, you couldn't find a way to build it.
Entire facility, total renovation of the entire facility, and resources, beds, and all those.
Best seat and stuff.
So many things. This is a detailing room. So we decided to give out to people who want to meals. That's how we do. For all the clients that comes in, the IVs, bed rest, and detailing. We need a bigger space, more beds.
It should be nice.
You can collapse this one and get another one. If you keep it a crap one. Basically, you're and because of the wire, like I said, because of the wiring issue, it's a man to me and totally for film more. I need to mind, but when you cry, I say, now the main one is done. I mean, the subsequent ones can follow.
For now, we need our television.
If the wiring is not
I think
it's very good.
Is it working?
mini working. It's mini working.
I know it's not working.
It's not working like that.
It's not working as it should be.
It's working. I mean, it's a staff. We don't have a district technician yet, but we are looking
we need that
chance.
fridge.
When we come to duty, so there's always some
Double decker fridge.
that.
You need that fridge. Double decker.
There can be no problem. You don't know problem. Physician assistant, I'm Essuehyia Health Center, Konfi. I'm saying they said I'm behind. I made them call around. Who challenges need be challenges in the adorson. Aside the human resource side, no, and logistics are the man, infrastructure is also and then play me role. My Jumano, I said, I'm consuming mechanical challenges now, infrastructure challenges, maybe to say roofing sheet now, roofing facility in the roofing now, a leak in shelter. And in fact, a crab like and yet a can't leak in crana could just ask me, Mamma, I be a cry. A poancasa to say dam, to say dam, Mancasa. Am I in be pony now? Okay, lab was a kind of space now, kind of say, more my lab no, it's not or more train resource no. It's also no building Nancasa, so I will your cracks or building in roofing in 9 yet is your trouble say go almost it's an internet pay for no mobile mail lab now. Only baby point now. That's a mutia nothing shoot to see so that I say some no cry. Lab no space na kasana lab personnel no wo no ye lab no ehia say I say ye biem ama because lab akasa I say the place must be aerated I say from afar or ventilated na kana say so heat ba ho because heat ba ha ma reagent ni be there air spy nti be hia air condition so sa room no asa say ye biem amam kese no na fe waiting area no so you be create a different waiting area be well protected and shelter and to me mobile lab na munya baby so atna that's for the lab side no na facility no na make no can say wires no musi ache a chapel time to no musi facility no into renovation bia she dan call so up to now ya say bit by bit be able na yakoso ho bia bia yakoso omo sheda ntina omo ho omo so mu yemaya no omo sheda ntina omo ho enya ntino say omo hwe menatie for omo hwe na mposo omo bitimi aba abebo ya no ke be hia say ka omo renovate the entire facility with kind of omo rewiring re-roofing baby a ho dey some tini no matene ni sana mani na ye hia resources so a ye de be adwuma nkonya your client me betina so o hwe bo say your plastic chairs plastic chairs we dey use we enemy so ni bia by your kind say patient kind say your backrest a obetimi atena 3 in 1 dey bi metal one bi nya bi so amount for the be brand a be boy ama kind say your client ne ba almost ni beje o say edwuma na ye no pempe no answer na obi ka ba facility no ohwe facility say dey etie ho ye fe asana wa ba say ho nya fa omba because how ho ye fe na che dey yeso ye wa ha say nti say eno no endi kan amba even no say ye gbo edwuma kra na obi cha wo tie o hu say ye gbo edwuma nti na say facility ne tumi ye fe na tumi attracting crofo e mama ba account e ko fi ye dia ani facility a wo hayi na no social health center and population bebre ama for can say ye hwa ama for bebre can enema pi na maternity also so can say o hwe ye koye no na hu roofing say na aye na isu na eto a eba ebegu TNJ no so no spread because say roofing na say nti ama spread all part of the unit ama ni na say ye TNJ breaking it down nti ama hono so eliki nti na meka ne be hia say be renovate the entire facility anya say bia RC for the nimpe OPD for the nim everywhere be bia leki na where wire no so ehu hia pa empa mo da so empa da so no de ne krani enye empa ni bi wa sometimes no depend on the condition and the pakone ba no ebi ma mo de cardiac problem ebi wa mo de respiratory problem ebi kwa head injury accident e be nkwa accident case ba na e ba nti ebi wa case ni bi ba e so to me tilt impanity no e was some number of degrees bi abebo ama pressure na o mo trim no betimi minimize nti ebi wa 30 degrees ba ye mpane yetimi tilt the no ye ni cardiac bed bi awa ha tutudi ni bi straight one obudi ma tight kwa wa se kwa tutututu nti mpane o ha yina bi en ho papa wo nti ebe hia empa so be a donation say empa beba and the best sheets na there but most importantly empa no any can say omo mobile with respiratory distress no so I say yenya can say ebi wa timi resuscitate omo ne ma omo sort of oxygen yes you need oxygen cylinder bia e betimi use sometimes won say after emergency beba no na ani bi wa e betimi aye I say you refer now if you stabilize now refer now you are doing harm to the person at least automation now so stabilizing kakransa na why then what refer no nti ye hia ne marketing getting be brain nti na e bia you betimi let ni na down ama mo na bia mo da to dwa ama mo tiefo but for the time being no ye hia mpa ye hia oxygen concentrator ye hia rewiring of the facility ye hia re-roofing ye hia repainting you say be the trees kakra e wa ha say you waiting area because sometimes the client and relatives ne ba be one more doors patient ba ko ni kind of be 2010 omu na mutimi ra inside that say you baby e nice e be kind of lovers bench or leisure bench you be quite this is advantage point about how they can sit in whilst we are attending to their relatives it's in here na we bre na say
first and foremost, I want to thank Nana for this opportunity to support us through her links. We're grateful. I think we eliminated a lot of the challenges facing us as a district health service. Essuehyia facilitating this total renovation, total rewiring, hosting the accommodation for our staff, transport, to enable our staff go for medical outreaches to communities, very important, medical equipment. We had two model health centers, Essuehyia and Otuam, then the polyclinic, which is now our hospital. So all these big facilities, in addition to the 18 or 22 compounds that we have, need equipment and accommodation. So anybody who listens to us through your medium can come to help us. We are willing to receive that help with open arms. And thank you.
And I play beside there, and they buy Kunfi or Essuehyia Health Center. Now, on them, they sort of high or Mr. Sunuba, a Dana Muntina, but director you want kwapro waso kan za ihu ni na za oye wa humbu mu na za waso ka botim that I can't tell you for that waso botim ya boa eso sente
yo e confirm that say am there awankas na italika say insuna no rugu edan na mu ntane na me hu ni mambeze bai na me yim there e bia roofing sheet kru bi e kra na there bi na ceiling na asai ma damenti insuna ya dam na unfortunately me bai ni za me hu no ya atete o ya reho because hospital ye baby a ye ntapo a ye be gina na yaresa na za me be hu wa han ihu the hospital facility ni here a total overhaul baby era problem from wiring roofing it looks like onye nyipa kro na ejuma maybe I name dey be a roofing sheets in the bay 3 and 2 be able to affect on your one man job cry the whole facility here a new facelift enti meye ma femizi but mesre there obiara ofi confirm obiara wo Ghana kro mu a odwun nyimpa ho Ombra no mboboa na yen nyina yen hwe na yen sesi hospital ade because aha na nkrofo beje wona yaresa aha na nkrofo beje wona nkwa nti message do bia baba ba yen mbo na ezezi dem dwuma otedam especially ekonfufu a wo akwantum ebenya wona mboa papa ebe sere obetwe wanyiwa wa hwe na echi ama won ba na aza wo akwantum ya watum da chi wozo aba be fie na wakeda aha na won so ofi because oya reho pa
titi wa ha ma oya wa humbo pa
yako especially there my can one wa hade nti I just can't imagine now there say means na me ba wo me ba ha it's scary eko room honum dey room a impanin ye roofing ye can you imagine that awo ba fofu na insuru to no rugu modo oya tete oya yimhihye eko theater na amba na wajhu awo na oya rehumpo ndemu baby awiase di na eba beje nkwa na da eba na ebe wo ha baby bebre na se wo hospital ha dey oya tete me oya ma yimhihye de obi bayer na waba ha oya mezene pa ti
Yeah.